capacity strengthening is a central agenda in digital health. So, what does capacity strengthening mean? What are the capacities we want to strengthen? Is it about how we use digital technologies? Is it about how we address public health problems? Is it about how we uh, maintain these interventions on the ground? They could be many different things uh, relating to capacities of public health informatics. So let me start by trying to differentiate between capacities and capabilities. I think there's a subtle difference there, which often we don't consider too cleverly. So, capacities relate to how we learn how to use a digital tool. Yeah, so it's basically a skill-based view that we open the software, we start with step 1, step 2, step 3, step 4. And as we do that, we are learning how to use the software, we enter data, we export data, analyze data, etc., etc. That's capacity. Yeah. So, what do you think are the limitations with capacity? A focus on capacity. A focus on capacity is implying that we are we are trying to tell the staff, the health worker, that it's important for you to do these steps in order for you to be able to do your job more effectively. That's fine. That's important. But does that then contribute to sustainable use? So once your job is finished or you move into another job, or then how will that use of the technology continue? That is the challenge for which we have drawn upon Amartya Sen, his idea of capability approach. And what his capability approach says is that we need to create intrinsic motivation, something which is inside us, which is driving our use of the technology. For example, when we were doing training of health workers in Andhra Pradesh once, 20 years ago, the health worker said, yes, we use the technology for sending data because that's what we are supposed to do. But we would also like to use this technology for teaching our children how to use the internet, how to use Accenture. Once my son knows how to navigate internet, he can help me in basic things which I'm involved in, like making budgets for the home, etc., etc. So these tasks are not something which I'm supposed to do as a part of my job, but these are tasks which are important for me to do by myself. These are intrinsically motivating tasks because they relate to my home. And this is what Amartya Sen says, that we need to build capabilities, not just capacities. Capabilities are those which are intrinsically motivating, which are not something which is being forced onto me by my bosses to do the work I'm supposed to do, but it is to give me the skills and this thing for me to skills and expertise so that I can do more than what I'm supposed to do with my job. Also, to work on things which are important for me intrinsically, personally. So in this program on courses on digital public health informatics, we have tried to identify areas which we believe would be intrinsically motivating for the students to build their capabilities, which can take them forward on their career in as a public health informatician. Thank you.